with the story that we just saw, essentially we saw an example of a migrant mother and daughter who are receiving care, medical care through a nonprofit, Casa Alitas, in Tucson, right? But as we know, that's not the only way that these migrants receive medical care. Some of them are apprehended by Border Patrol. Border Patrol then sends them to these hospitals, local ERs, clinics, things like that. So essentially the big question is, how are we paying for these migrants to receive these medical care?
Well, it depends. So first and foremost, it depends on the condition that the migrants have. The federal government has an actual fund called Emergency Medical Services for the care of migrants in the case of trauma or pregnancy or acute conditions that need immediate reversal. But beyond that, that program doesn't pay for care. Say if someone has kidney disease and needs dialysis, that program wouldn't pay for it. So there's a pool of money for the emergent care of people who are in dire need and who would die otherwise. But beyond that, just general wellness or general care or taking care of people who have other medical needs, it depends. Oftentimes it lands on the hospital or on the healthcare system or on the charity or community health center that takes them. I don't know if that's the greatest answer, but that's the answer I got.
Yes, it's a complicated answer, right? And it's a complicated issue altogether. Now moving on to essentially from what you have seen, right, and being the ER, being in these hospitals and things like that, with this influx of migrants, what does it look like for the medical field? Are resources being stretched thin? Is it an issue when it comes to all these people needing this medical care?
Well, without getting too alarmist, most emergency physicians would say we face challenges every day with the population that we see anyway. Almost every day, the emergency department will be overwhelmed by the amount of people that come in during the time that they come. So long wait times, people boarding or waiting for inpatient beds, staying in the hospital, people with psychiatric problems staying in the ER waiting for some service later. Those are things that we face on a daily basis. So adding an additional sort of unfunded mandate, if you will, to the emergency services presents a challenge. Now, we're in this for the care of people. We got into medicine for the health and wellness of people. So we welcome the patients as they come, and we will take care of them regardless of their ability to pay. But oftentimes resources are required, and we will need some help there.
And now, a big part of this is also some of the policies, the legislation, the laws that are in place in order for, that are connected to this issue. As we know, when you go into a hospital, regardless of your immigration status, regardless of your ability to pay or not, you are able to get care, right? So what are some of those legislations, those laws that are connected to this issue?
Well, one of the things that the healthcare community feels very strongly about is that we are not police. We are not the immigration police nor any type of police. We want to take care of people as they show up and meet the needs that they have to try to save lives or improve their lives. A couple of years ago, we faced the possibility of having to ask immigration status, and largely we were against it because we are going to treat people one way or the other. The broader question you ask about the policies and sort of the patchwork is a good question, because really there is an absence of coordination right now. The federal government, the state government, the county government, healthcare entities are all trying to do the best they can, but as far as an overall coordinated response, there isn't one.
Thank you so much to Nicholas Vasquez for coming on into the studio, sharing some insight on this broader issue of medical issues and costs going into this migrant crisis that we're seeing over at the border. We really appreciate your time. Thank you for joining us.
Thank you.